And a 2021 report found that Pennsylvania hospitalizations were twice as expensive for patients with COVID-19 compared to patients without COVID. Fox 43's Paula Belloso spoke to a man who was hospitalized with COVID, and his medical bills amounted to over $1 million.
Same thing coming up. Use the legs.
Barry Stein was in the hospital for 14 weeks with COVID-19 in March of 2020. The last thing on his and his family's mind was the hospital charges they would be dealing with after.
I think it was closer to the end of the year before we saw the full amount that was the cost of his full treatment.
The amount?
The full amount of the bill was $1.2 million. It's shocking.
They say their insurance would have been able to cover about 50% of the costs. Most of the costs they were left with was covered by the CARES Act. In the end, they only had to pay between $200 and $300. They say they're lucky.
We couldn't have paid that off and maintained, even the smallest reasonable amount of money for retirement.
We would have needed a payment plan, but it still would have very much depleted retirement savings.
Lifetime retirement savings, and we would have been paying for the rest of our lives.
According to a new 2021 report by the Pennsylvania Healthcare Cost Containment Council, COVID-19 made hospitalizations more expensive in 2020.
That number is $53,578. Cases without COVID. Cases with COVID were $104,179.
However, experts say the average hospital charge is not necessarily what you will usually have to pay at the end.
The costs would differ based on the insurance company's policies and the benefit structure.
The report covers the 2020 fiscal year, which ran from October 2019 through September 2020. They hope it can serve as an assistance to providers in displaying additional opportunities for quality improvement and cost containment. In York, Paula Belloso, Fox 43 News.